Did you know that hydroxychloroquine has been saving lives for over 70 years? This single medication treats 3 completely different diseases and affects millions of people worldwide. But here's what most people don't know about it. Today, I'm sharing 9 critical facts about hydroxychloroquine that could change how you think about this controversial drug. From its surprising origins during World War II to the latest research findings, these facts will give you the complete picture. Whether you're a patient, a caregiver, or just curious about medical science, these insights are essential. So stick around because fact number 7 will shock you about who should never take this medication. Here's something that will blow your mind. Hydroxychloroquine isn't some modern wonder drug created in a lab yesterday. This medication has a fascinating backstory that goes back to World War II. Picture this: soldiers were dying from malaria faster than bullets could kill them. Scientists desperately needed a solution. They took quinine, a natural compound from tree bark, and modified it in laboratories. The result? Hydroxychloroquine was born. But what exactly is this drug? It belongs to a class called antimalarials, but here's the twist: it does so much more than fight malaria. Chemically speaking, it's what scientists call a 4-aminoquinoline compound. Don't worry about memorizing that name, but understand this: its unique structure allows it to slip into cells and change how they behave. The really shocking part? This drug can treat autoimmune diseases, infections, and even reduce inflammation. It's like having 3 different medications rolled into one pill. When you swallow hydroxychloroquine, you're taking the same basic compound that saved countless soldiers decades ago. The only difference is that today's version is safer and more refined. This single chemical structure has been quietly revolutionizing medicine for over 7 decades, and most people have no idea. Fact 2. Primary medical use is malaria, but that's only scratching the surface. Let me tell you the full story of what this remarkable drug actually treats. First up, malaria. This drug prevents and treats one of the world's deadliest diseases. Every year, malaria kills over 600,000 people, mostly children in Africa. Hydroxychloroquine stands as their shield against this microscopic killer. Travelers heading to malaria zones rely on this medication to stay alive. But here's the shocking part: in 1956, doctors discovered something incredible. Lupus patients who took hydroxychloroquine felt dramatically better. Lupus is a disease where your immune system attacks your own body. Imagine your body's defense system going rogue and attacking healthy tissues. Hydroxychloroquine somehow calms this internal war. Then came another breakthrough. Rheumatoid arthritis patients found relief too. Their painful, swollen joints improved significantly. The FDA officially approved it for these conditions, making it a triple-threat medication. Today, millions of people with autoimmune diseases depend on this drug daily. It's not just treating symptoms, it's actually slowing down disease progression. Think about it: one medication fighting malaria parasites, calming lupus flares, and reducing arthritis pain. That's why doctors call it a game changer in modern medicine. Fact 3. How it works in your body. Get ready for this, because how hydroxychloroquine works inside your body is absolutely fascinating. When you swallow that little white pill, it embarks on a microscopic journey that sounds like science fiction. Here's what happens. The drug travels through your bloodstream and does something remarkable: it sneaks into your cells and changes their internal chemistry. Think of your cells like tiny factories with different compartments. Hydroxychloroquine specifically targets compartments called lysosomes, which are like the cell's recycling centers. Now here's the mind-blowing part. By changing the acid levels in these compartments, the drug disrupts how viruses and parasites reproduce. For malaria parasites, this is a death sentence. They literally cannot survive in the altered environment. For autoimmune diseases like lupus, the mechanism is different but equally impressive. The drug calms down overactive immune cells that are attacking healthy tissue. It's like having a peacekeeping force inside your body, stopping friendly fire incidents. But patience is required. Unlike painkillers that work in minutes, hydroxychloroquine takes 1 to 2 months to show full effects. Your cells need time to adjust to the new chemical environment. Many patients give up too early, not realizing that this slow-acting medication is quietly rebuilding their cellular defenses from the inside out. Fact 4. Common side effects. Let's talk about what most patients experience when taking hydroxychloroquine, and trust me, this information could save you from unnecessary worry. The truth is, side effects are common, but they're usually manageable and temporary. Here's what happens to most people in the first few weeks. Your stomach rebels. Nausea hits about 30 minutes after taking the pill. You might feel queasy, lose your appetite, or experience diarrhea. This happens because the medication irritates your digestive system initially. The good news: taking it with food dramatically reduces these problems. Then there's the cosmetic stuff that freaks people out. Some patients notice their skin getting rashes or becoming more sensitive to sunlight. Others see changes in their hair. It might thin out slightly or change texture. These changes sound scary, but here's the reassuring part: they're usually reversible when you stop the medication. The timeline matters here. Most digestive side effects improve within 4 to 6 weeks as your body adjusts. Your stomach literally learns to tolerate the medication better. The skin and hair changes typically reverse within months of stopping treatment. Here's the key insight: doctors continue prescribing this medication because for most patients, the benefits far outweigh these manageable side effects. The temporary discomfort is worth the long-term disease control. Fact 5. Serious safety concerns. Now we're getting into the serious territory that every patient needs to understand. While hydroxychloroquine is generally safe, there are 2 major risks that can be life-threatening if ignored. First, your heart. This drug can cause dangerous changes in your heart's electrical system. Imagine your heart like a perfectly timed orchestra, with electrical signals conducting each beat. Hydroxychloroquine can disrupt this rhythm, causing what doctors call arrhythmias. In extreme cases, your heart could stop beating properly. This risk increases if you're taking other medications or have existing heart problems. The second major concern will shock you: your eyesight. Long-term use can cause irreversible damage to your retina, the part of your eye that processes vision. The scary part: this damage often happens without symptoms until it's too late. Patients wake up one day with permanent blind spots or blurred vision that cannot be fixed. Here's what makes this particularly frightening: the eye damage is dose-related and cumulative. Every pill you take adds to your lifetime exposure. After 5 years of use, the risk becomes significant enough that some doctors reconsider continuing treatment. This is exactly why regular monitoring isn't optional, it's mandatory. Blood tests check your heart function, while specialized eye exams detect retinal changes before permanent damage occurs. Fact 6. COVID-19 controversy. This is the controversy that put hydroxychloroquine in every headline and sparked heated debates worldwide. Let me give you the real story behind the chaos, because the truth is more complex than most people realize. When COVID-19 hit, desperate doctors tried everything. Early, small studies suggested hydroxychloroquine might help patients recover faster. Hope spread like wildfire. Political figures endorsed it. Pharmacies ran out of stock. Patients with lupus couldn't get their life-saving medication because of the sudden demand. But here's what the science actually shows. Large, well-designed studies paint a mixed picture. Some research suggests a modest benefit, around 15% reduction in severe outcomes when given early. Other studies show no benefit at all. The timing of treatment seems crucial, with early intervention showing more promise than late treatment. The controversy intensified because of how the research was communicated. Small studies were overhyped. Political endorsements clouded scientific judgment. Social media spread both hope and fear without context. Here's the current medical consensus. Hydroxychloroquine might offer small benefits for some COVID patients, but it's not the miracle cure many hoped for. The risks often outweigh the benefits, especially for hospitalized patients. Most doctors now reserve it for specific cases while focusing on proven treatments like vaccines and newer antiviral medications. Fact 7. Dosage and administration. Here's the dosing information that could literally save your life, because getting this wrong can be dangerous. The proper dose of hydroxychloroquine isn't one size fits all, and the calculation method might surprise you. Doctors don't just guess at your dose. They use a precise formula based on your body weight, typically 6.5 milligrams per kilogram of your ideal body weight daily. For an average adult, this usually means 200 to 400 milligrams per day. But here's the crucial part. They calculate using your ideal weight, not your current weight. This prevents overdosing in overweight patients. The timing matters more than most people realize. You should take hydroxychloroquine at the same time every day, preferably with food or milk. Why? Because consistency maintains steady drug levels in your bloodstream. Skipping doses or taking them irregularly reduces effectiveness and can trigger flare-ups of your underlying condition. Here's something shocking. Splitting the daily dose works better than taking it all at once. Many doctors prescribe 200 milligrams twice daily instead of 400 milligrams once daily. This reduces stomach upset and maintains more stable blood levels. Never, ever adjust your dose without consulting your doctor. The difference between an effective dose and a toxic dose is smaller than you might think. What works for your friend might be dangerous for you. Fact 8. Who shouldn't take it? This fact could literally be life or death information for some people. There are certain individuals who should never touch hydroxychloroquine, and the reasons will shock you. First up, people with G6PD deficiency. This is a genetic condition affecting about 400 million people worldwide, mostly men of Mediterranean, African, or Asian descent. If you have G6PD deficiency and take hydroxychloroquine, your red blood cells can literally explode. This causes severe anemia that can be fatal. The terrifying part? Many people don't know they have this condition until it's too late. Heart patients face another serious risk. If you have any heart rhythm disorders, heart failure, or take medications that affect your heart's electrical system, hydroxychloroquine could trigger dangerous arrhythmias. Your heart could stop beating properly, leading to sudden cardiac death. People with severe kidney or liver disease can't process the drug normally, leading to toxic buildup. Pregnant women need special consideration because the drug crosses the placenta to the developing baby. Here's the scariest part about drug interactions: combining hydroxychloroquine with certain antibiotics, antidepressants, or heart medications can create a deadly combination. The interactions aren't always obvious, which is why you must tell your doctor about every single medication, supplement, and herbal remedy you take. One overlooked interaction could be fatal. Fact 9. The monitoring requirements. Here's the final fact that ties everything together, and it's absolutely critical for your safety. Taking hydroxychloroquine isn't like popping a vitamin. It requires careful medical surveillance that could save your vision and your life. Your eyes need professional monitoring every year, sometimes more frequently. This isn't a regular eye exam at the mall. You need specialized tests like optical coherence tomography and visual field testing. These detect retinal damage before you notice any symptoms. The shocking truth: by the time you notice vision changes, the damage is often permanent and irreversible. Blood work monitoring is equally crucial. Every few months, doctors check your liver function, kidney function, and blood cell counts. Hydroxychloroquine can quietly damage these organs without obvious symptoms. Regular testing catches problems before they become life-threatening. Your heart needs monitoring too, especially if you're at higher risk. EKGs track your heart rhythm, watching for dangerous changes that could prove fatal. Here's what many patients don't realize: skipping these monitoring appointments isn't just risky, it's potentially catastrophic. Insurance companies understand this importance and typically cover these tests because the alternative, treating permanent organ damage, costs far more. The bottom line: hydroxychloroquine can be incredibly beneficial, but only with proper medical supervision. Your monitoring schedule isn't optional, it's your lifeline to safe, effective treatment. Conclusion: so there you have it, 9 critical facts about hydroxychloroquine that most people never learn. From its World War II origins to modern monitoring requirements, this medication is far more complex than anyone realizes. Remember, knowledge is power. But medical decisions should always involve your healthcare provider. Never start, stop, or change this medication without professional guidance. Your doctor understands your unique situation and can weigh the benefits against the risks. If you found these facts valuable, hit that like button and subscribe for more medical insights that could change your life. What surprised you most about hydroxychloroquine? Drop a comment below and let's start a conversation. Until next time, stay informed and stay healthy.